This program is a paid commercial announcement and in no way represents the views of WPH.D or its management.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
I want you to know that in 2.5 hours, spring officially arrives.
Thank goodness.
And Dr. Molly and I are so excited, we almost wore our shorts, but decided it's a little too cold for that. Good to have you with us as always. Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. What is this show about? Well, the clue is in the title. It's about health, and specifically what Dr. Molly Fantasia does, who is the PhD doctor, executive director, and founder of Innovative Medical Associates, Marlton, New Jersey. We talk about the who, what, when, where, why, and how of Innovative Medical and how it can potentially help you, and how a lot of people who have been into the clinic, and this week it was standing room only for a couple of days. We talk about how people come in and have some medical challenges, and Dr. Molly, in many cases, is able to help them. So we'll talk about that. And, of course, if you have a question or a medical challenge, 855-839-1210. That's the number, 855-839-1210. At any time during the course of the show, if you have a question or a medical challenge that you want to run by Dr. Molly, of course, you just call in, pick up the phone at 855-839-1210. It's a good idea we're still in our long sleeves because it's,
I agree,
it's a little.
John. We're still in sweatshirts.
Right,
yeah,
it's a little cool, but it's good. Spring is on the way.
Right.
Talk about Innovative Medical Associates, and I know this week was a very busy week.
Yeah, it was.
In fact, one day, I mean, I was fighting for a seat. So
come on, John. Now nobody has to fight for.
Well,
a
it wasn't a fight. It was,
We try to really accommodate.
It's all good. It's all
good. Here, part of the problem, John, from our perspective, is people like each other so much they want to come in all at the same time so they can chat.
Yeah,
and
exactly.
catch up for
exactly.
the week from the week.
Exactly.
You know?
Yeah.
And I guess in some respects, it's probably better than Cheers used to be, where they went in to drink. Right.
Right.
Here, they're just getting healthy.
So to talk about, people do love to come in because it is, I have to say, because I'm a patient, it's like a family atmosphere.
Well, we try.
And certainly people are very friendly, and we start talking about a variety of things. But talk about, the real meat and potatoes of this is what you're doing and what is being accomplished. So talk about that, what you do.
Innovative Medical Associates is a cooperative that works out of my primary care facility. And so, therefore, all the healthcare providers there can do anything that we would normally do in a regular primary care. We say this every week. So if you need an antibiotic, can we whip out the prescription pad? Do you need a note to go back to work or school? We have the prescription pad. You need your note for a problem with your DMV? We have all of that. We can do anything that a normal primary care physician's office or outpatient or urgent, in fact, more like a sort of convenient care facility that you can do anywhere else. But the focus of what we do is we want to use the least amount of pharmaceutical necessary to effectuate the medical change that we're looking for, keeping the patient out of harm's way, and also reducing the side effects from the remedy, so to speak, as well as the condition.
What you're doing with your hydration,
right?
That's natural substances, correct?
For the most part,
right.
It is natural substances. Of course, we can deliver certain IVs of pharmaceuticals as well if a patient needs it. But yes, we are using natural substances to augment the prescription meds that patient might be on, or we also have protocols that actually support people through certain chronic kinds of conditions. And the whole objective from our perspective is to increase the quality of life for a patient.
A lot of people ask you in the initial consultation, well, is there any side effects to this? Because you talk about side effects to prescription meds, which we all know there are.
Right.
But how about with the natural substances?
You and I both know there can be side effects with natural substances. For example, that's why you need to make sure you know what you're ingesting. Meaning, when you go to a health food store or to the drugstore, to the health food department now, the vitamins, the minerals, you need to know, what are they made of? What are they extracted from? All of those things. But in 26 years, I guess we're going on, we have had many less side effects than you could do any other way. If any, maybe an occasional blood sugar that goes down, not up, goes down. So why? We encourage our people to have crackers, to drink water while they're there, that kind of thing.
So there's minimal side effects as opposed to prescriptions, because we've often talked about this on the show. Prescription drugs, you get the paper, and there's the book coming next to your prescription telling you all the potential side effects.
Right, exactly.
So this is not
this
the
is
same kind of thing.
Certainly better than using prescription meds. Now, that doesn't mean I want you to throw away your prescription meds. We're not going to do that. What we would help you with is to make sure that you're utilizing your prescription meds also in the best way possible.
You have talked about a variety of conditions that you've helped people with over the years, and I guess in 26 years, you've probably found just about everything there is to find as far as...
we started out with chelation. You know, chelation has been around a long, long time, and that we used lots of times for cardiac issues. And we've run the gambit all the way through autoimmune conditions and, of course, our cancer supportive therapies. So, again, and by the way, also just plain utilizing of natural substance to improve your quality of life and enhance your quality of life. So we have a myriad of issues there.
And I've often said this on the show that I don't remember, and I'm going to knock on wood, the last time I had a cold. Because, it's just talk about quality of life. It seems like the immune system is always,
hopefully it's in an optimal
position.
Right.
And I don't really feel anything negative, like a cold or anything. So,
but, John, you have a myriad of problems.
That's
now.
true.
Let's be honest. You don't have one type of pre-existing condition. You have several. And I would say you are typical of most of our patients that come through. They have more than one condition.
Right.
One condition might be the driving force for coming in a particular time, but you'll find that after doing lab work, after sitting and talking with patients, they have more than one condition.
You have mentioned often about people coming in once a week, twice a week, sometimes 3 times. Is there a norm, like when you start?
Sure.
How does that work?
Sure. For certain protocols, you have to all protocols must get to a therapeutic level. So the question becomes, what's going on for the particular patient? And can we get them to a therapeutic level in once a week? Well, sometimes yes, but many times no. Many times they need at least twice a week. So again, it depends on the seriousness of the problem that brought them in, what they're looking to accomplish, and over what period of time. But I will tell you this, if they follow what a protocol that we put in place for them, most people start to feel better within the first 3 to 5 weeks.
You've often talked about time and
Tincture
after
of time.
Time after, let's say, a surgery, and you need that time, and a lot of people don't have the patience. And I know that's been something that you've always talked to patients about.
Right.
What can you expect? Realistic expectations. You have a surgery, let's say to remove a tumor or whatever.
Sure.
How long should you come in after that?
Well, it depends. Again, what did you remove? Are you having a tumor removed because it was cancerous? So obviously they're going to want to put you on some traditional treatment, and if you choose to go that route, my job would be to prepare you for getting through those traditional treatments the best way you can and keep your quality of life. So, as you know, right now I have a wonderful patient, Michelle. She's been in twice since her surgery, twice a week. I mean, she had to take a few weeks off because she had to get healed, to get herself together. But now she's been pretty judicious in coming in twice a week. And I would say that is appropriate for someone. Now, other people have used what we did as a therapeutic kind of process. And again, I meet a patient where they are. For example, everyone knows Pam. Everybody in our place knows Pam. She's a cancer survivor and she's cancer-free, thank God, for many, many years. In the beginning, she came in 3 times a week because she chose not to do anything conventional after the surgery.
So it can run the gamut from one to the other.
And here's the thing. Again, this is what separates us from the spa-like places. Look, I want to know what it is you want to accomplish, and can we help you get there in a safe manner? So we meet a patient where they are. If they want to do chemo, they want to do radiation, they want to do traditional, let's say traditional autoimmune drugs that are IV, we will help you. That's what we're here for.
I should mention that many years ago when I had a bladder tumor and I had surgery, and then the tumor came back.
That's right.
And I asked you what can be done to prevent this from happening again, and you told me about this procedure.
Oh,
and
yes,
I went and
it's
I
an
got
old
it.
time.
It's called a wash or something
Right,
like that.
exactly right.
And it was like 6 weeks in a row.
That's right.
And guess what? Again, knock on wood.
6 weeks in a row.
Never came
and
back.
You came in to see us
Right.
twice a week.
Right.
And we enhanced what I believe was the outcome of that
Right.
treatment. And by the way, that was a very old treatment, and they use an old goody DMSO and some other things. So it was interesting.
All right, we're coming up on our first break of the morning. Our show is called Health Watch, and you'll find us here every Sunday, 8 till 9, the live version here on Talk Radio 1210 WPHT. Got a question for Dr. Molly? Got a medical challenge? 855-839-1210. You know, we always tell you, and this is true, call early or, call during the course of the show, because last week we unfortunately had 2 calls we couldn't take because they called at 9:01 when we go off at 9. So it's a little hard to manage that, But give us a call, 855-839-1210, 855-839-1210. The show is Health Watch. Sundays 8 till 9, Talk Radio 1210 WPHT with Dr. Molly Fantasia. I'm John DeMasi. We both return. More Health Watch after these words. As always, when we're on the air here with you on Health Watch, operators are standing by at Innovative Medical Associates. And you can contact them if you're a little bashful, you don't want to come on the radio, but you want more information, 856-489-0505. That is the number, 856-489-0505. Call, and they'll be happy to answer your questions. But the best thing you can do, and you hear a lot of us talking about different things, you can get specific when you sit down with Dr. Molly and go over your particular situation. The initial consultation is complimentary. All you have to do is call that number and set it up, 856-489-0505, 856-489-0505, and the website, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. A lot of good information on that as well. Check it out. Our show is called Health Watch, and you'll find us here every Sunday, 8 till 9, the live version on Talk Radio 1210 WPHT. And again, our number here in the studio, if you have a question for Dr. Molly, 855-839-1210. We're going to talk about peptides.
Yes.
Specifically, to begin with, as far as your men's health program is concerned. Can you please explain what is a peptide?
Well, here's the thing. The question came up with one of my guy patients who said to me, well, Molly, are peptides hormones? Well, no, actually they're not. They're made up of small chain proteins. But many, many times in the use of, let's say, in terms of men's health or sports, I would say more in line with fitness, people have used peptides, and it does tend to give people somewhat of a little more advantage in some sports. However, can they have side effects? Yes, and that's why people think that peptides are hormones, because they look at them and they say, well, yeah, can it have side effects like the hormones give you? For example, when you're using testosterone in a steroidal, the testosterone as a steroidal, but they also use peptides to enhance the function of the testosterone. So you notice that in bodybuilders in particular,
yes,
right? We know about it and all this stuff. Well, here's the thing. You still have to know where you get your peptides. I know there's a ton of places on the internet. There's a ton of places that talk about sports medicine and the use of steroidal compounds as well as peptides. So I want people to be aware that they truly are not a hormone, but they have been used in athletic to enhance athletic ability in ways that's similarly to steroidal compounds, but they aren't. Technically, they're not. But they can have the similar side effects if used incorrectly or overused. So again, I want people to understand, when we use peptides in our facility, we're actually looking at bioavailable, bioactive peptides. And you'll say to me, well, how is that? Well, these are extracted from natural substances. And would you believe that they can be extracted from fish, meat, milk, and plants? So I use a lot of plant-based bioavailable peptides, in particular for my cancer patients and also for autoimmune patients, John.
So I was going to ask you, you kind of answered the question, that peptides are used not just in your men's health program,
No.
but in other programs.
Exactly. And as you've heard me talk, because you've heard me speak about interleukins, peptides, and cytokines before. Yes, we utilize these things, but you want to utilize them correctly. You want to have a physician who understands the use of these. That's where somebody like me comes in handy with my docs. I will pull off some scientific literature and say, look at this. I want to tell people something else. You know, we're running around this area in particular and talking about the new immunotherapies. Lots of those are bioengineered peptides that are found naturally, and they've seen that the natural substances have actually helped in cancer and anti-cancer tumors, etc. And so now the pharmaceutical companies have jumped in and bioengineered synthetic peptides to help do that. And that's been some of the basis of immunotherapies.
It seems to me that you talked about side effects and you mentioned steroids, but I'm thinking that with peptides there may be some, but obviously less side effects, correct?
Right, if used appropriately and you know what you're really getting. And I think that's really the key to this. So there's a lot of data out right now, and you can look at this, again, from PubMed. You know me, I'm always looking at the abstracts and everything. There's a lot of data for the potential role of bioactive peptides in the prevention and treatment of chronic conditions. So that, when they're saying chronic conditions, they're looking at cancer, autoimmune, that kind of thing. And let's talk about a peptide that's very familiar to everybody, collagen. And as you know, I deliver collagen through the hydration.
Yes.
And is it beautiful for skin? Sure. But isn't it interesting that I read an article that says, here's the thing about all of the peptides. They have an anti-inflammatory, they can be antioxidant, and so they have a real place. But in terms of skin disorders, right, you use the collagen, but there was some data that showed too much is just as bad as too little. So where am I? The Goldilocks theory again. Proper use of the peptides is the key to the utilization of them.
Again, you've often talked about things that are not quick fixes.
Oh, yeah.
And this is not a quick fix, correct?
No. Actually, this week I have a patient who has eczema and psoriasis, very, very bad eczema and psoriasis. She came in this week. I've used some peptides on her as well as some other things in the hydration therapy. She came in this week. She said, look, Dr. Molly, look at my skin. Well, she had about a 45% improvement in skin head to toe. Let me tell you something, that was big. Also, she got improvement with her joint pain. She truly has an autoimmune condition of the psoriasis and psoriatic rheumatoid type of problems. So let me tell you, John, there's a real place in traditional medicine as well as integrative medicine for peptides.
Let's talk about, you said this is not a quick situation. What is a realistic expectation if you're using collagen and you're a cancer support patient?
Well,
realistically, what can you expect?
Well, look, you and I both know, in terms of the cancer supportive therapies, regardless of what other peptides I'd be using, you're going to be in for like 30 treatments. I mean, as simple as that. So 30 treatments in about 15 weeks would be the timetable that I would look at, depending on looking at certain parameters, which we would do through the blood work. As a matter of fact, I was lucky enough this week, and John, I don't want people to spend a whole lot of money in these fancy testing that you send out. It's $800 for this test, $900 for that one. I mean, there are some tests that we can't do traditionally through LabCorp Quest, but really, when you look at enhancing people's autoimmune systems themselves, there are specialized testing that we can get through those particular laboratories, and they can do a good job, and we get the data we need to show that the cancer supportive treatment is kicking in and you're doing well.
So the testing that you do, what I'm hearing is that you do tests that you believe are definitely necessary.
Pertinent to the thing.
And sometimes you can overtest.
Well, what I'm saying is, I'm not even saying overtest. I'm saying sometimes you go into these integrated facilities, and I'm thinking of places that you go in and you're spending $5,000 on the testing and you haven't received any treatment. And so you haven't gotten the supportive qualities. You may leave with a prescription of the nutraceuticals you need, but you haven't really made a dent in what brought you there in the first place.
So it seems like the crux of this is not just the testing, but the hydration therapies, which can enhance whatever you need.
Enhance your quality of life. Look, bottom line is, I had another situation this week. I've had a really interesting week.
Yes, I know.
And so I had an interesting week. Someone came in and they had gone to a very well-known integrative facility that was out of the country, and they spent, I think, $70,000 while they were there. And they came in and they said, we're cancer-free. I said, that's wonderful. I mean, I think it's wonderful. How are you going to be doing your supportive follow-up? We don't have enough money for that. Well, look, we have to make a living. I got to pay my nurses, right? But I got to tell you, I think we're one of the best bargains out there, John.
Well, we should say that your treatments are not $75,000. We should mention that so that people don't think that's what you.
No, I'm just saying
but,
it was like
that's a lot of money.
I think it blew me away because of how they answered me. They said, "Oh, well, we don't have enough money to do follow-up." Well, guess what? I mean,
which doesn't make sense in the long run.
Right. You want someone who's going to follow you all through your cancer continuum, right?
Yes.
Look, nobody knows. Honest to goodness, I believe cancer is a chronic condition. We all have cancer cells. The question is, how can we keep our quality of life, keep cancer from overburdening our bodies? And again, that goes back to the immune system and how we treat ourselves wherever the continuum is.
All right, we are at the halfway point of the show, which means you have plenty of time to call in with a question or a comment for Dr. Molly. It's Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. 855-839-1210 is our number here in the studio, 855-839-1210. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. And I'm your host, John DeMasi. Again, that number, 855-839-1210. We're coming back. More of today's Health Watch after these words. As you probably know by now, operators standing by at Innovative Medical Associates, and you can contact them at any time. You can call right now, or you can call after we leave you at 9 o'clock. You can call later on this afternoon, 856-489-0505, 856-489-0505. That is the number for Innovative Medical Associates, located in Marlton, New Jersey. Call, make an appointment to sit down with Dr. Molly. Remember, the initial consultation is complimentary. And this week was a busy week for Dr. Molly, as they all are. But you can call, and she'll find some time to talk to you about your particular situation. 856-489-0505. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. As I always say, a lot of good information on that as well. Our show is called Health Watch. Every Sunday we're here, 8 till 9, our live version on Talk Radio 1210, WPHT. We have a lot more to talk about here on the show. And if you have a question for Dr. Molly or a medical challenge you want to run by her, of course, our number here in the studio is 855-839-1210. I was watching the Today Show the other day, and here comes Maria Shriver. I was thinking of you. I almost text you and said, hey, watch this. Okay. Maria Shriver does a report. Mm-hmm. On autoimmune disease.
It's all over.
In the report, it says, and she interviewed several people, of how they go to a doctor, and he says it's all in your head.
I say it every week.
You say it every week.
I see it in my office every day.
So
You know,
this is a national trend.
it is. It absolutely is a national trend. And I'll tell you something, John. What is so infuriating to me is, look, bottom line for anybody out there, you've got to listen to the patient. What is going on for the patient? All the testing in the world. Do you know how many times tests can come back in a normal range? Remember, what is a test, John? A test is a snapshot
Right.
of a particular day, particular hour, and that's it. Okay? That doesn't mean you don't have something. Believe me.
Yes.
It doesn't. Hey, COVID is a good thing, right?
Absolutely, yeah.
How many of us ran in to get tested? We were exposed that day. Come on. Look, but with chronic conditions, we need to look at this and evaluate the data. And that means the qualitative data that a patient tells you. I have joint pain. I have this rash all over my body. I have some other issues. You need to take that and match it to the test. And that is a real art, I believe. I believe that is a real art, because if you listen to your patient, you will get to the heart of what's going on. And I think at that point, you'll be able to help them improve their quality of life. Because what Maria Shriver was saying is quality of life issues in autoimmune is what drives people to the physician.
Right. And then he's just saying, well,
it's in your head,
it's in your head,
particularly
right.
for women.
Right.
Although I have to tell you, I'm seeing more and more men who have actually autoimmune issues. And believe it or not, we look at things like lupus and scleroderma and all of that, and MS in particular. When men get it, it's worse than women. Isn't that unbelievable?
Well, it's interesting. A couple of weeks ago, I was going to get some surgery, and you did an EKG. Your office did an EKG.
Yeah.
And you read the EKG, and you said, you know what? Give this to your cardiologist, because it didn't look good.
It didn't look perfect.
Exactly. And the cardiologist looked at it and says, well, it's not really nothing to worry about.
Right. But it was
but there was a perfect example.
It had you had a slight type of challenge, and what we wanted to do is make sure your cardiologist knew about it, because you were treating with someone. That's all.
Right.
Now, you can have a test result like that. It's inconclusive is what that was.
Right.
And I said, this test result is inconclusive, and if we send it up to your eye physicians, they're not going to do the surgery. That's the real reason why I sent you to the cardiologist.
Exactly. So it turned out to be like
an little architectural issue. But here's the thing. You need somebody to help you interpret that, right? And make sure that you're on the right path in terms of what you need to get done.
If you have an autoimmune issue, and you've certainly treated a lot of patients with that.
Yes.
If you have an autoimmune, sometimes you don't even know you have it.
Correct. Oh, but
So-
you'll know when it's bad. You know.
Right. So how do you know, like, when to listen to the guy that says, oh, it's in your head, and when not to listen to him?
Well, I think if your quality of life is truly impeded, I wouldn't listen to him at all. Okay? Bottom line, I would search out what's going on. Look, it's the same old story. It's what I said to you earlier today. You can either look at the glass half empty, half full. It depends. But looking at it just right for what it is, that's why you go to someone. Am I truly having a problem? Well, talk to me. Are you able to walk a mile? No. Did you used to walk a mile? Yes. Do you have joint pain? Yes. Did you have joint pain before? No. Well, right there, I know something's going on. So you've got to say, okay, what is it? Is it purely age-related? And even that, by the way, John, I believe we can age well. Talk about it. We did that, anti-aging and longevity. We talked about that. We can anti-age so that, you're not stuck in a wheelchair when you're 80, right? I have plenty of patients who you can see doing that and enjoying life. Look, there's no point to saying I don't have something if you're suffering from symptomatology, period. Something's going on. The body is a beautiful gift from God, but we know something is going on if you're just not quite right. The other thing is, look, we're responsible for our bodies, right? We are. If you load up on carbs, sugar, refined sugar, that kind of thing, you're going to have a problem somewhere,
yes.
right?
Yes.
So,
absolutely.
What we have to do is be judicious in everything we do. if you go to a physician and you don't like the answers, change them. So simple.
And with your autoimmune treatment, I know a lot of people have come into you with that frustration, and you've treated them. Is this something that you are going to encounter forever? Is it ever get better, or how does it work?
You can have improvement, but it could be a condition that you're, unfortunately, the luck of the draw. I mean, I have a medical director who has MS. So, I mean, she has bona fide MS by lesions that were shown in the brain, that kind of thing. But if you had seen her last week skipping out of my clinic, you wouldn't believe it. And I
couldn't believe it.
I have the data to prove it, because what we did was we saw increase in stamina, increase in balance, these kinds of things. Now, that's a way. That's qualitative data. But guess what? The physical therapy people in an outside physical therapy place actually then put a numerical value to the improvement or the increase that she had. That's what you want. So yes, can you live with autoimmune? Yes, you can. You can.
But as long as you're getting some kind of help.
Look, bottom line is nothing is one-pronged. It isn't a question of just coming in and I pour the holy water on you and you walk out, you're a new person. No, there's also a certain amount of responsibility you have to take. For example, you may have to cut down on refined sugar, right? When you have cancer, we know sugar feeds cancer, right? I mean, it's simple as that. So what do? We tell you, let's hold off on, 5 scoops of ice cream a day. I mean, these are simple things. But I would not just sit back and let someone tell me it's all in my head if I'm having a quality of life issue that I didn't have before.
Interesting. You were mentioning your medical director, and I remember not long ago, a couple of months, I mean, she did look terrible.
She did.
And then you were right. The other day I saw her kind of like running out of your office. I mean, it was like...
Well, I don't blame her. She was running away from me, but it's okay. Yeah. But that was because we used some different therapies, including progenitor cells. But I can tell you that there is hope. The other thing, I can't take it. I personally can't take it when someone tells a patient, there's nothing else we can do for you.
Yeah, and you've heard that. You've heard that a lot.
Guess what? What do you have to do then? Then you've got to find somebody or something that can do it with you, because you should not be left in a state where this is all we can do for you.
We are coming up on our final break of the morning, which means you still have time to jump in with a question or a thought for Dr. Molly. You have a medical challenge you want to run by her. Well, now's the time to do it. 855-839-1210. That's our number here, 855-839-1210. Our show is called Health Watch. You'll find us here every Sunday. Our live version, 8 till 9, here on Talk Radio 1210, WPHT. Again, that number, 855-839-1210, with Dr. Molly Fantasia. I'm John DeMasi. We're coming back with more Health Watch after these words. Back here on Health Watch, operators standing by right now, and they'll be there well after we leave you at 9 o'clock this morning. In fact, they'll be there all day if you have questions, you want to talk to the folks at Innovative Medical. 856-489-0505, 856-489-0505, and the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, if you miss any of today's show, we have, well, sometimes we call it the sleeper special. We have our Health Watch replay 4 until 5 this afternoon here on Talk Radio 1210 WPHT. But this is our live version, so we're going to go to the phones right now. Catherine is in Chemung, New Jersey. Catherine, good morning. You're on Health Watch with Dr. Molly.
Hey, Catherine. How are you?
Good morning. Hi, Dr. Molly. I'm doing great.
How are you? Good. Good.
Yeah, talking about autoimmune disease and the treatments, I mean, they definitely do work. I mean, prior to seeing you, my quality of life was really down. I would go to work and come home and I just wanted to sleep. And, now I'm up and about and finishing and going to get my postgraduate degree. And I know none of that would be happening if it wasn't for your treatment.
Thank you. And you know what, Catherine, I'm going to let a shout out. You are a nurse. You are a registered nurse, and you're pretty smart. And I know you're going on for an advanced degree, and God knows we want to help you because we want people to understand that you can combine therapeutic process. We can help people through their quality of life issues, and we're not telling them to give up on traditional medicine. That's not what we do. We really just want to help, and we want people to have a quality of life. I think you've summed it up beautifully, and I want to tell you it's been a privilege for our perspective to know you and to treat with you. God love you, Catherine. Thank you.
I love you guys. God bless you.
God bless you.
Thank you, Catherine.
Bye-bye.
Thanks for the call. Perfect example of what we talked about today.
Great call, and a great gal. She's going on for she's going on to become a nurse practitioner, and boy, do I want her when she's done. So
Which
there it
she
is.
probably wouldn't have been able to do.
Well,
Because, I mean, becoming a nurse practitioner, that's not an easy,
not
that's not a
easy.
piece of cake.
No question about it.
All right, let's talk to John in Bucks County. John, good morning.
Hey,
You're on
John.
Health Watch with Dr. Molly.
Hi, John.
Hi, good morning. Hi, I love your program.
Thank you.
I just have a question.
Sure.
My mom has history of TIAs, and she just actually had a stroke in April of 2020. But she recovered great. I mean, my mom's
Thank
physically
God.
strong.
Thank God.
And she doesn't have any other medical conditions.
Right.
She's 83, but they had her on a statin.
Right.
I'm not a big fan of statins. I'm a pharmacist, and
You're a smart boy. You're
I
a
just do a lot of
smart
research.
boy.
I'm not saying that they are not somewhat effective as far as decreasing the inflammation,
Right.
as far as keeping the plaque against the endothelial lining. But
Right.
we saw an increase of her serum creatinine,
Right.
and she went into kidney failure.
Oh.
And so we took her off the statin.
Right. Right.
You know, discussing with the nephrologist, I felt, you know, we both agreed. So my question is, what in your practice have you used to replace a statin, if you can replace statin? I have her on aged garlic.
That's great.
And also on fish oil.
Good. Good.
And, you know, I have her on quercetin.
Quercetin
but-
is excellent. Excellent.
So
How about?
I always think there's someone who knows more than me. I know there
No.
is. So
No.
I defer to you.
No, don't defer to me. I have a lot of respect. I'll tell you, I have a lot of respect for pharmacists because you
Well, thank
guys,
you.
in many, many ways, tend to have more patient interaction than their physicians do now. I have to tell you, it's pretty scary out there. So I agree. May I ask one other question? What's Mom's kidney functions now? How are they doing?
So it's actually gotten much better.
Okay.
We have her serum creatinine down to 1.15.
Okay.
But we're
okay.
actually now going to be testing her in another week. She was up in the sixes.
Oh my God. Oh my
Yeah,
God.
and she just bounced back. Like I said,
Thank God.
metabolically, she's excellent. Like my mom, as always, she lives with me now because she developed
Sure.
vascular dementia,
Oh,
unfortunately.
sure.
So it's getting better. We go to see the nephrologist in about another month.
Great.
So
Great.
I had her. I'm trying to think. I try to hydrate her, but
Good.
right now it's at 1.15.
Okay. So with that kind of creatinine, I would be a little bit hesitant to put her on a hydration protocol. So I think what
Okay.
you're doing is you're doing everything that's well. If she goes down to 1.1 on that creatinine, I'll tell you, I would definitely be able to reduce the fluid and also use some of the chelators to see if we could open up some of the vessels.
Okay.
You know, and I think we could absolutely do it. I've treated a lot of people where we help them. You're giving her a lot of good product. And if you call my office, I will give you some brand names, but I'm sure you're already familiar with them, and maybe you're giving them to her. I can't give it out on the radio because, like,
I have a practitioner account, so I give her
Good.
a lot of the practitioner brands like
Great.
Thorn, Pure
Great.
Encapsulation, things like that.
Great. Oh, great. That's a wonderful product. See, I can say it's a wonderful product if you're using it. Good. I appreciate that. Thank you.
Well,
This is
one
a
other-
great call.
Can I have one
Yes,
other
sir.
question? I know
Sure.
you guys are pressed for time. Do you treat patients that have vascular dementia? Because I feel that nothing has touched it.
Yes.
And I didn't know, and I listen to you guys all the time, and I know you're in Cherry Hill.
Yes.
Is it Cherry
Well, I'm
Hill?
actually
Okay.
I'm actually in
Marlton.
But it's
I'm next to
Okay,
Cherry
okay.
Hill.
Yeah.
Okay. So
And I have-
I always I've been meaning to call and maybe come over there and make an
Sure.
appointment, or because again, I've tried everything for my mom, and I know vascular dementia is not reversible, but it's sad
It's
the way she is,
I'll tell
right
you.
now. It's hard to see.
You know what? Let's talk a little bit about some of the newer developments in some other areas. I think we could help you. Yeah, but let's get that
Okay.
creatinine up.
John,
Dale.
feel free
Thank
to. You can call
Thanks,
Dr.
John.
Molly anytime. You can
God
call the
bless you.
operators now, but you can
And-
call during
but
the week.
During
Yeah.
the week, I definitely
Yeah.
will. I will call you back if I'm with somebody or something. John, you're an interesting guy. You're doing everything right, and God bless you.
Thanks for the call,
Thank
John.
you.
Good luck with that.
That's a wonderful call. Yes, vascular dementia is very difficult, but there are some new things, including with the progenitor cells out there. And I have a couple of studies that I would love to share with him.
We have about a minute left,
Okay.
and I know you wanted to talk about lung conditions. You've seen a
We're
lot of that
so much
since
of
COVID.
that.
Is it
So-
COVID related?
Yes, I would say COVID related, environmentally related. I'm seeing a number. You know what else I'm seeing, John? An increase in heavy metals that people are exposed to. Don't know why. Just seems to be happening. I don't know if it's related to possibly the environment that we're in, because New Jersey has strict environmental rules.
That's right.
But nonetheless, I am seeing an increase in that. But I would tell you that the lung conditions we're treating, we really have been treating very, very successfully using a specific type of hydration. And of course, using what? Vitamin C,
That's
among
right.
other things.
My favorite.
Your favorite. And, the high antioxidant ability. But also because what? Vitamin C turns into hydrogen peroxide, which is very interesting, and we can talk a little bit more about that when we have more time.
Okay. That is going to put the wraps on this edition of Health Watch. Don't forget, operators are standing by right now, and they will be there well after we leave you at 9 o'clock. In fact, they'll be there all day if you like. 856-489-0505 is the number. 856-489-0505. That's Innovative Medical Associates, located in Marlton, New Jersey. And the website, innovativemedicalassociates.com. innovativemedicalassociates.com. And don't forget, you can catch today's show again this afternoon from 4 to 5 here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, delightful Dee, Joanne, fabulous Fran, and our nurses Jess and Lana, and our medical assistant Karen Kathy, I'm John DeMasi. Always a pleasure. Thanks for listening. Have a great week and a healthy one. We'll do it all over again next Sunday. Health Watch, the live version, 8 till 9. Talk Radio 1210 WPHT. You take care.
This program is a paid commercial announcement and in no way represents the views of WPHT